Thank you very much. Good morning, everyone. Actually, it's noon. I apologize for changing it last minute, but we had a confidential call with the Chief Medical Officer of Health at the same time, so I had to postpone it. I apologize. I'm going to give you a bit of an overview of where we are locally, and I'm going to go over our new dashboard, and then I'll give you sort of an overview of some of the provincial direction, including the sort of our thoughts on the recent announcement that was just made or will be made about rapid antigen testing. I'm going to start by sharing my screen and giving you a bit of a run through of our new website and our new statistics. In terms of our local statistics, our hospitalizations are now 24 with 5 in the ICU, and I want to make it clear that that is individuals who are in the ICU and or hospitalized that are there because of COVID, not because they tested positive. And we have different numbers that we'll be sharing with you as well. Our positivity is 17.9% right now, which is in a downward trend. Our outbreaks are now down. We were up in the 50 range, and so those are going in the right direction. Our deaths have stabilized. Unfortunately, we had some deaths over the last couple of weeks, but that seems to have stabilized as we're seeing province-wide as well. And so I just wanted to run through some of the different indicators that we're now going to be posting regularly on our website. And so let's start with percent positivity. As you notice, there's not going to be any cases or active cases because we're no longer testing everyone, but a lot of these indicators give us a flavor of, the overlying or underlying sort of transmission in our community. So I just wanted to show you our positivity rates. This is basically going to be the daily average numbers. For some reason, it doesn't show it there, but we do have a map where it'll be, they're in the process of upgrading it right now. So that's the reason. But there's going to be, again, in the positivity section, by area code of FSA, they're called forwarding address to the following areas. And I can just tell you that Hawkesbury and Cornwall remain the highest in terms of our positivities, but overall, our positivities are going down. We were in the 30s, now we're in the 17-18% range. In terms of our institutional outbreaks as well, we're on a downward trend. In terms of our hospitalizations, again, there is a downward trend as well. For that, there's going to be two graphs here. That one is going to show the actual number of all hospitalized patients in all our hospitals, including Ottawa, of people that just tested positive. And then we have another one that's basically on the 4 hospitals in our area that are there for COVID. And both are going downward, so that's a good trend as well. We're also going to be having our wastewater numbers. And again, what we're seeing is that we're going to be seeing a downward trend. So that to me is important. We're also going to be looking at the vaccine administered, and we're going to be looking at the number of cases and so on, the number of third dose and fourth dose and so on. And so the next thing I want to share with you will be sort of a continuation of this, which is going to be another sort of more in-depth detail of our vaccination rates. And so at this point, we are, we're at about 80. If I look at our numbers, we're 88% first dose in our region, 83% second dose, and about 57% third dose, which is about 100,000 third doses. In terms of children, we're at 50% right now first dose. And you could see here, we break this down by area code, and you could see Rockland and Russell have higher rates, whereas we have lower rates in Cornwall and lower rates in Hawkesbury in terms of vaccination rates. And it's not surprising that they correspond with a higher positivity rates in those areas. In terms of the provincial picture, again, we're seeing sort of a downward trend across the province, which we're sharing. And you can see here that most of the health units right now, if not all, save for one, are actually on a downward trend in terms of average cases. And we're right here, we're downward trend. And in terms of the positivity as well, again, some of the health units have gone up, but the majority are on the way down, including ours, which is good news. If we're looking at the provincial metrics, and if you match those with our local statistics as well, The 7-day rates are going down. We do still look at the 7-day rates, but again, we're just comparing. So they're down. They're being reported daily. To date, we've had I think in our area 13,000 positive cases in our area, and a lot of those have occurred really over the last month or so, probably more than half. Again, the cases that we're picking up are reflected more in the high risk settings, but again, just gives us a flavor of those cases. So there's been a 44% decrease across the province. There's been, in terms of cases, there's been a decrease in death rates. In deaths, positivity has decreased, a number of outbreaks have decreased, hospitalizations have decreased. They're actually half right now that they were in the peak of this Omicron wave. And just for context, wave 3, we maxed at 2,000 cases admitted to the hospital. Wave 4, we were at 4,000 cases admitted to the hospital. But the ICU numbers didn't go as high, which speaks to the fact that Omicron is a milder infection, albeit it can hospitalize individuals as well. And the ICU numbers have gone down as well, 22% over the last 14 days. One of the things that I just want to reiterate as well is, again, the rates at which people are being hospitalized based on their vaccine status. So the red here is 1 or no doses, or really not vaccinated or partially vaccinated. And so you could see that overwhelmingly, and it's age dependent as well. Obviously, all of the severe disease that we're seeing are predominantly in people 60s and above. And you can see across the board for hospitalizations that the rate of admission is much higher than 2 doses, and certainly much higher and even more higher than 3 doses. And the same could be said, in these age groups. If you look at ICU admissions, it's the same pattern. No dose, 2 dose, 3 dose. You could see again a level of protection that's conferred by the 2nd and 3rd doses. And unfortunately, you see the same pattern in deaths as well. And again, overwhelmingly, what we're seeing, the patterns is that the majority of severe disease occurs mostly in the older age groups. And that's why I'm very keen to be able to vaccinate this population, at least in terms of the rates right now. Our 80 plus are at, I've got it broken down here, 80 plus at 86%. 3rd dose, 70 plus is 85%. 60 to 69 is 76%. So I'd like to see all of those go up to the 90% range. That's going to be very good to protect them, because you can see that's where we need that protection. I also would like our 50 to 59s to go up as well. Right now we're at 57%, our 50 to 59-year-old age group. And that is that it really is a challenge to us. We need to get it up. Our area, like I said, we've got a lot of individuals in their 50s who have a lot of chronic medical conditions. So I would really like that 50 plus age group to reach the levels of that they've had a 2nd dose, which is really in the high 80s. And so to me, that's really important. I just wanted again to reiterate that the 3rd dose is really can make a big difference. In fact, I showed this last week, you can get up to 68% effectiveness against infection and against transmission. And so that's much better than we have with 2 doses. With 2 doses, you get maybe 10% protection, 15% protection. So this increases your protection at least 6-7 times in terms of being effective of just getting the infection. And it significantly, and it increases from 80 to 85 protection to 90 to 95% protection, hospitalization, and against severe disease. So it's very important that we keep that in mind as we move forward. And so, and speaking of moving forward, you could see that we've got the roadmap to reopening right now. We're basically here, and where we've got 10 indoor, 25 outdoor, and you could see that we're planning next Monday, actually, not the following Monday, the Monday of Family Day, to increase capacity to 100%, 50% spectator with no limit, with no cap. Right now, there's a cap of 500, and then social gatherings increasing indoor and outdoor, and so on. And then you can see that if we are progressing very nicely, as we're doing with the numbers going downwards, we'll then be looking at 100% capacity, still having proof of vaccination at that point, masking, of course, and those things will be drawn back. I think it's a sensible approach of reopening. reopening, we're doing capacity, we're doing all these other things. Once we're plateaued in March, then we can reevaluate and look at, do we require passports? Do we require masking and so on? But still, for now, until further notice, those things are still in place. That's what we mean by the additional protective measures. One of the things that I'd like to just sort of show you as well is the recent addition to the modeling by the advisory science table, which shows that it assumes that there's about 2 to 3 million people who've been infected. I know the numbers show about 1 million people in Ontario. In our area, it shows us we got like 13,000 in our area. But for every one that you probably diagnose, probably 2 that are not you haven't tested. So you're probably looking at our area about 40,000 people that have been infected. And in Ontario, we're assuming about 3 million as well that have been infected as well. And so because it's 1 million, and then twice as much, so you add that, and in the scenario where they have different scenarios, so where there's low community immunity, sort of moderate community immunity, and then high community immunity with 8 million boosters. Right now, we're about almost 7 million boosters in Ontario. So you could see with the green line, you kind of see a bit of an uptick over there. But if we are able to give 10 million boosters, right now we're almost at 7 million boosters in Ontario. And if we're able to bring it up to about 10 million boosters, combine that with the recent infection that people have had with Omicron, which will confer some immunity, we'll be able to tolerate sort of the openings with really a flattening of that curve, and then sort of going downwards as we move forward. So to me, it's very important that although it's not mandated, that people should get their third dose. And just to contextualize it for us, when we're looking at our doses, we got about 100,000 people in our area that have received their third dose, and in total, we've got 180,000 people that have received their first dose, and 169,000 that have received the second dose. So, our goal is to reach about 144,000 people at least to give us that equivalent, so we can get the flattening and downward curve. So we're about 44,000 doses away between now and the end of February. So hopefully we'll reach that. The higher we can get the third doses, the better we'll be able to tolerate the openings, which is the bottom line. We want to be able to move forward in combination with some of the antiviral medications that we have, and the increased vaccination rates, more knowledge about ventilation and all these things, to be able to tolerate and live with COVID. The pandemic is not going to go away, but we'll be able to live with it, and at the same time keep the society open with some precautions, but not to close it down, and at the same time protect our vulnerable populations from getting sick and requiring hospitalizations. And at the same time, we're preserving hospital capacity so they can reopen and allow to do their usual procedures and surgeries that have been, as you know, sidelined for almost 2 years now. So I think we're in a good position. And it's just, like I said, it's just a matter of us being a bit more patient about it. One last thing I just wanted to say is that today there'll be an announcement that there's going to be rapid antigen tests made available free in over almost 3,000 outlets, pharmacies, and grocery stores across Ontario. There will be multiple ones in our area as well. We'll be getting the map, and we'll be getting the locations this afternoon. But that I just want to caution individuals that we're using those rapid antigen tests are really to be used to diagnose you. So if you're symptomatic, if you're positive, it's reliable. If it's negative, it's not going to help unless it's negative for a couple of days. So it should be used for symptomatic confirmation, and that one may help to decide whether or not one is isolated or not. And it should not be used for testing. I'm good, negative, I can go out and party. So that's the thing that I just want to make sure. There's also going to be a change in the way that the recommendation of the swabbing that's going to be. There's going to be more information on that on the website, on the ministry website. But as soon as we get that information, obviously we're going to share it publicly and with the media, so people will be able to get those tests. Again, I caution that just because you're doing a rapid antigen test doesn't prevent it. You need to get vaccinated. You need to adhere to masking. You need to adhere to the public health measures. So that's very important. Jenna, I am finished.
Thank you, Dr. Paul. Merci. Notre première question, Benjamin Vachet, Radio-Canada. C'est à vous?
Oui, bonjour, Dr Roumeliotis. Une première question concernant donc la levée des restrictions. Hier, le Québec a annoncé il a annoncé son plan pour la levée de plusieurs restrictions dans les prochaines semaines, prochains mois. Je voudrais juste savoir, en termes de télétravail, le Québec a annoncé que l'obligation de télétravailler prendrait fin à partir du 28 février et que ce serait juste recommandé. Comment ça va se passer en Ontario et c'est quoi, vous, votre recommandation?
Euh, euh, Actuellement, les nouvelles règlements qui sont en place depuis le 31 janvier c'est pas mandaté, c'est recommandé. Donc, ma position est que si c'est possible, de faire le télétravail.
Parfait. Et puis une seconde question, le docteur Roumeliotis. Justement, vous avez souligné qu'il fallait aller de manière progressive, mais on voit que dans d'autres provinces, ça va peut-être même un peu plus vite, la levée des restrictions et notamment la fin du passeport vaccinal.
Oui.
Est-ce que l'Ontario devrait accélérer? Pourquoi nous, on adopte une stratégie plus lente peut-être? Et quand est-ce qu'on peut imaginer la fin du passeport vaccinal, par exemple?
Je pense, je viens de faire trois autres médias avant la même question. Je peux vous dire que je pense que la vitesse le rythme avec lequel Ontario va faire le réouvrement, je pense que c'est la bonne chose. Je pense que c'était précoce de faire ça aujourd'hui, comme à étant donné que leur chiffre augmente encore à l'Alberta. Je pense que nous, on fait ça de façon progressive. On nous donne 2 à 3 semaines entre chaque étape, si vous voulez. Donc, je pense que mieux qu'on allait doucement, doucement, et on ne va pas reculer. Et je pense que ça va donner un peu de temps aussi pour atteindre le 10 millions de troisième dose, parce que je pense que ça va être important pour nous aussi. Donc, avec tout ça ensemble, je pense que le rythme, la vitesse avec laquelle Ontario le fait, je suis d'accord avec cette approche. Je ne suis pas d'accord avec l'approche qu'Alberta et Saskatchewan qui ont pris.
Merci, docteur Paul.
If anyone else has questions, please unmute yourself now. S'il y a d'autres questions, vous êtes invité à ouvrir votre microphone. Benjamin Vachet, c'est à vous.
Et une dernière question, docteur Roumeliotis, juste parce que justement il n'y avait pas d'autres questions, mais pour le passeport vaccinal, par contre, lui, quand est-ce que vous pensez qu'il faut lever le passeport vaccinal, qu'il n'y ait plus l'obligation de le montrer dans les commerces, les restaurants, les bars?
Je pense qu'on n'est pas là encore. Je pense que c'est à peu près après mars. À mon avis, ça va être quelque chose qu'on va revoir. J'aimerais avoir un taux d'immunisation au moins aux personnes 50 ans et plus important qu'on a aujourd'hui. Je serai plus confortable à ce moment parce qu'on va les protéger. Donc, je pense que ça va être réévalué dans les prochaines semaines. Donc, je ne pense pas qu'avant le mois de mars, ça va être enlevé. Mais même si c'est enlevé, je pense que je vais encourager les personnes d'aller chercher la troisième dose.
Merci beaucoup.
Pas de problème.
Other questions? D'autres questions? Those are all the questions for today, Dr. Paul.
Thank you. Merci.